Good afternoon, everyone. I'm Marley.
I'm Kirsten.
I'm Maya.
I'm Amanda.
Okay. Thank you for being here with us today. We're really excited to talk about something that affects so many families, communities, and especially the people we care about: fall prevention for older adults.
Falls can seem like just another part of aging, but they don't have to be. With the right knowledge, small changes, and a little teamwork, we can make a big difference in helping older adults stay safe, confident, and independent.
As we were preparing this presentation, we realized how often falls go unnoticed until they happen. But what we learned is that many falls are actually preventable, and that's why we're passionate about sharing this information with you today.
Together we'll walk through some of the most common risks, practical strategies, and helpful resources. Our goal isn't just to give you facts, it's also to empower you with tools that can truly improve quality of life. So let's get started and explore how we can all play a part in preventing falls.
I'm here to talk about why fall prevention is so important and a few simple things we could do to stay safe. Falls are very common, and 1 in 4 older adults fall every year. That means in a group of 4 friends, chances are one of them will experience a fall this year. Falls are also the #1 cause of injury for adults aged 65 and older. When someone falls, it could lead to broken bones, hospital visits, and very long recovery times. But even more than that, many people become scared of falling again. That fear can make them stop doing activities they enjoy or move around less. And when activity goes down, muscles get weaker, which actually increases the risk of falling again. The good news is that most falls can be prevented. There are simple daily habits that can make a difference. So now we're going to talk about some primary prevention things that you could do every day to reduce your fall risk. First is exercising. Doing daily strength balancing exercises help your legs stay strong and improve your stability. These don't have to be hard. You could do things such as gentle leg lifts, standing on one foot while holding a counter, or walking for a few minutes each day helps a lot. Next is home safety. Make sure your living room is clear, well lit so you can see, remove clutter, secure loose rugs, and keep walkways clear. Small changes can prevent big accidents. Vision hearing checks should be done every year. Even small changes in eyesight or hearing can affect your balance. And finally, review your medications. Some medications can cause dizziness or make you feel off balance. Talking with your doctor or pharmacist can help lower that risk. So remember, falls are common, but they are not a normal part of aging. So thank you.
I'm covering secondary prevention, which is all about catching risks early before someone actually experiences a fall. This is the stage where we're trying to identify the problem before it becomes an emergency. One of the biggest tools we use is the tug test, or the timed up and go. It looks super simple, but it tells us a lot. The person stands up, walks a short distance, turns around, comes back. If they take too long or look unsteady, that's a sign that their mobility is changing. That's huge because changes in gait are often the first clue that someone's balance or muscle strength is declining. We also do general gait assessments. We're looking at step length, whether they shuffle, how stable they look when turning, and whether they need to grab onto furniture. Even tiny changes can tell us something about fall risk. Now, red flags. These are symptoms we don't ignore. Things like dizziness, new weakness, or sudden blurry vision. Those can be caused by dehydration, low blood pressure, medication side effects, or underlying conditions that haven't been diagnosed yet. Then we look at the when to seek help piece of it. If someone is having chest pain, if they hit their head, or if they are confused or not acting like themselves, that's not just a go lie down type situation. That's a get evaluated immediately moment. Confusion especially can be a sign of infection or a neurological issue. And then lastly, we encourage weekly self-monitoring. I like to explain it as doing your own mini little check-in. So like, do I feel more wobbly than last week? Does standing up feel harder? Does walking feel different? Older adults can catch patterns early just by paying attention. The earlier you notice a change, the earlier we can intervene and prevent a fall.
So I'm going to be discussing the tertiary prevention strategies we have for older adults in preventing falls. So this entails what prevention strategies we have once an older adult has fallen. So our focus shifts to helping them recover and prevent it from happening again. One of these resources is rehab. This includes physical therapy, which helps them build back strength and balance, and occupational therapy, which helps make everyday activities a lot safer and easier for them, again, helping them with their strength and mobility. A lot of people also benefit from home health support. This includes nurses or caregivers who check in and help them manage their medications and make sure they are healing safely. Another important thing to consider when preventing falls in the tertiary sector is their home environment. So simple things like improving lighting and removing clutter, adding grab bars, or using non-slip mats can make a huge difference in preventing falls. And because chronic conditions can raise someone's fall risk, helping them manage their health and safety is a big part of prevention too, which again kind of goes back to medication management, or if they have, again, like mobility issues, making sure they're using their assistive devices properly.
So I'm going to talk about health promotion and why it's important. Health promotion focuses on encouraging positive lifestyle habits that help people stay active, independent, and healthy. Simple daily movement routines like stretching, walking, or light exercises can improve mobility and reduce the risk of injury. Support groups and community workshops are also helpful because they keep people connected, motivated, and engaged. Setting small, realistic goals builds confidence and helps individuals track their progress. So overall, when mobility improves, quality of life improves, and people feel more confident, more capable, and more involved in their community. Next, I'll talk about the population health factors that affect people's overall well-being. Income can limit someone's ability to modify their home. For example, they may not be able to afford grab bars, ramps, or stronger lighting. Housing hazards like stairs or dim lighting also increase the risk of falls. Transportation plays a big role too, because if someone doesn't have a reliable transportation, they may struggle to access medical care. Finally, limited social support can increase health risks by contributing to loneliness and making it harder for people to manage their health. These factors connect to our bigger population health goals, which is addressing the determinants of health, reducing health disparities, improving health outcomes, engaging the community, and ensuring high quality health care. When we understand the challenges people face and promote healthy habits, we can support safer environments and healthier communities.
So I'm going to be discussing the tertiary prevention strategies
These are the biggest takeaways that we want our audience to walk away with. Falls are preventable. A lot of older adults think falling is just something that happens as you age, like it's inevitable, but we know that's not true. With the right strategies, most falls can be avoided. Proper footwear and vision checks are more important than people realize. Shoes that are too loose, too slick, or too worn down can throw off your balance. And vision changes make it harder to see hazards, steps, or even uneven flooring. Strength and balance exercises are absolutely essential. Even 10 minutes a day can make a big difference. Things like chair stands, heel-to-toe walking, Tai Chi is all proven to reduce fall risk. Then we have modifying the home environment. Most falls happen at home, not outside, so improving lighting, removing clutter, adding grab bars, or using non-slip mats can help prevent a lot of accidents. And finally, following up with your provider after any fall, even if you feel fine. A fall could be a sign that something bigger is going on. A medication adjustment, a new diagnosis, or a mobility change may be behind it. So follow-up is about figuring out why the fall happened in the first place. Okay, and to wrap this up, this slide is basically a one quick page summary that older adults can take home and use as a daily reminder. The first tip is to keep your pathways clear. Most people don't think about how much clutter can become a trip hazard, especially at night. Clearing walkways, picking up cords, and keeping floors organized makes a huge difference. Second, wearing supportive shoes. We know a lot of older adults love their slippers, but I love my slippers, but a lot of slippers don't have traction or support. A supportive shoe stabilizes the foot and reduces slipping, sliding, or like missteps. Third, review your medications. This is one of the biggest hidden causes of falls. Blood pressure meds, sleep meds, mood meds, all of these can affect balance. A quick medication review can prevent accidents. Fourth, a daily balance exercise. They don't need to be like equipment or like a gym. You can do simple exercises at home to help maintain your strength and stability. And our last tip is using night lights and grab bars. A lot of falls happen between the bedroom and the bathroom at night. Good lighting and something to hold on to can reduce that risk significantly. These are small changes, but they work.
Thank you for listening and watching. Have a good day. Bye.